Get ready for an exciting adventure into the world of the first trimester of pregnancy. Have you ever wondered what happens in those early weeks? Did you know that things are changing even before you realize you're pregnant? Join us as we dive into the amazing journey of the first trimester. Have you felt those early signs like tender breasts and queasiness? Did you know that your pregnancy's clock starts ticking before you even conceive? From the very start to around week 13, your body and the little life inside you are going through a lot of changes. During this time, something incredible is happening. Your baby's important body parts and systems are beginning to form. It's like nature's magical blueprint taking shape. But this journey isn't just smooth sailing. Sleepless nights, mood swings, and a bunch of changes might be in store. Don't worry, we're here to guide you and share helpful info as you go through these changes. Are you excited to set off on this journey of discovery? Let's explore the fascinating world of the first trimester together. Stick around till the end for all the important info and insights. Welcome to today's informative video on diseases associated with pregnancy. Today, we will be diving into the topic of health issues that can arise during the first trimester of pregnancy. Let's get started. The first trimester lasts until the end of the 13th week of pregnancy. You may begin feeling signs of pregnancy like nausea and tender breasts. Fetal development starts when the egg is fertilized. By the end of the 13th week, all of its organs and body systems are developing. What is the first trimester of pregnancy? Pregnancy has 3 trimesters or stages. Each trimester is about 13 weeks or 3 months long. A full-term pregnancy lasts 40 weeks or between 9 and 10 months. It may seem strange, but your pregnancy actually begins on the first day of your last menstrual period. This is called the gestational age of the pregnancy. A healthcare provider calculates your due date by adding 40 weeks to the first day of your last menstrual period. So this means, by the time you know you're pregnant, you're already about 4 weeks along. This can be very confusing. How long is the first trimester? The first trimester begins before you're pregnant. It starts on the first day of your last menstrual period and goes until the 13th week of pregnancy. What can I expect in my first trimester? Your first trimester of pregnancy is full of many physical and emotional changes. It can be a very overwhelming time, and your mind may be racing with questions. Plus, your hormones are in overdrive. In fact, your body produces more estrogen during one pregnancy than it does during your entire life when you're not pregnant. This surge in hormones can cause some unpleasant pregnancy symptoms. You may find yourself feeling moody, bloated, and tired. While you may not see a prominent baby bump yet, your uterus is expanding and your blood volume is increasing. It's okay to feel both excited and nervous. Talking to your friends, partner, or a healthcare provider may help you feel better as you navigate your pregnancy journey. What should I do in my first trimester? Your first trimester is very important. You might not look or feel pregnant, but lots of changes are happening. If you don't have a healthcare provider, you should find one as soon as possible. Getting early pregnancy care can help you avoid any potential complications. Make a list of questions or concerns you have so you're ready for your first appointment. Check with your health insurance about pregnancy coverage so you know what to expect and where you can get care. There are different types of pregnancy care providers that take care of you during pregnancy, labor, delivery, and postpartum. These include obstetricians, midwives, and sometimes, primary care physicians. In addition to selecting a pregnancy care provider, you may also consider places to deliver your baby. While most people choose to give birth in a hospital, some people prefer birthing centers or home births. Now is a great time to think about your overall health and what lifestyle changes you may need to make now that you're pregnant. For example, think about how pregnancy affects your work, finances, habits, and daily activities. How does the fetus develop in the first trimester of pregnancy? Several developments occur in the first trimester. Although you can't see it happening, there's a lot going on inside your body after sperm fertilizes an egg. Weeks 1 to 4 of pregnancy. During the first month of pregnancy, several important structures form. These structures are a tiny clump of cells, but will grow to become the amniotic sac, placenta, and umbilical cord. A tube that becomes the fetus's brain and spinal cord forms, as well as its circulatory system. A face, circles for eyes, and the beginning of a mouth take shape. The embryo is about 1/4 inch long, smaller than a grain of rice. Weeks 5 to 8 of pregnancy. Several major organs begin to develop during the 6th week of pregnancy, including the fetal lungs, heart, ears, arms, and legs. Bones begin to replace tissue. Its head is large in proportion to the rest of its body, but it looks more human now. The fetus has a distinct mouth, nose, and face. Some providers do an early ultrasound to confirm a heartbeat during this time. By the end of the 8th week of pregnancy, the embryo becomes a fetus. It's about 1 inch long or the size of a raspberry. Towards the end of your first trimester, the fetus will have toes, fingers, and nails. It will start to move by opening and closing its hands and mouth. The fetus's urinary and digestive systems are also fully functioning. At around 12 weeks of pregnancy, your provider can listen to the fetal heart using a Doppler ultrasound. By the end of the 12th week of pregnancy, the fetus is between 3 and 4 inches long, about the size of a plum. It weighs about 1 ounce. The first trimester is so important because most of the fetus's major organs and body systems are developing. Toxins, harmful substances, and infection can severely damage a fetus's growth and development during this time. It could increase your baby's risk of being born with a congenital disorder. Every person and every pregnancy is unique. An increase in hormones cause most pregnancy symptoms. Some of the most common are sore breasts. Nausea. Hormones may make your breasts feel tender and large. It's common to need bigger bras before the end of your first trimester. The veins in your breasts may become noticeable because they're carrying more blood. Other changes to your breasts may include darkened areolas or changes to your nipples. Morning sickness is one of the telltale signs of early pregnancy. Despite its name, it can last all day and all night. Try eating smaller meals or bland, low-fat foods. Mood swings. The sudden rush of hormones may put you on a roller coaster of emotions. You may alternate between feeling anxious or scared to excited or weepy within a span of 30 minutes. It may be helpful to talk through your feelings with a friend or your partner. Feeling tired. Your body is hard at work during the first trimester of pregnancy. This may leave you feeling exceptionally tired. Be sure to get plenty of rest. Most people get some energy back in the second trimester. Needing to pee. Your uterus begins to grow to support the pregnancy. It may begin pressing on your bladder, causing you to need to pee more often. Acne or other skin changes. Hormones cause your skin to create more oil during pregnancy. This can lead to clogged pores and acne in some people. Your heart is pumping more blood during pregnancy. This means your pulse may be quicker and you may find yourself losing energy more easily. Be mindful of how much demand pregnancy puts on your body and take rests when you feel tired or out of breath. What tests will I have in the first trimester of pregnancy? Checkups, screenings, and other tests during pregnancy help keep you and the fetus healthy. Care during pregnancy is commonly referred to as prenatal care. Prenatal care appointments are important because your pregnancy care provider discusses what you can expect during pregnancy and delivery, performs checkups and screenings, and answers any questions you have. Your first prenatal visit. You'll have between 2 and 3 prenatal visits during your first trimester. This can vary depending on your provider or if you're a high-risk pregnancy. You can expect to discuss your personal medical history, gynecological and obstetrical history, prior pregnancies and births, as well any family medical history that may affect your pregnancy. This visit is very thorough to make sure you and the growing fetus are healthy. At your first prenatal visit, your provider will calculate your due date. You can also expect them to perform the following: a physical exam, including checking your weight and blood pressure, a pelvic exam, a pap test, if you're due for one, tests to check for certain sexually transmitted infections, STIs. Check your pee for bacteria, protein and glucose, sugar. Order blood tests to check hormone levels, Rh factor, iron levels, and certain diseases. Check the fetal heart rate. Some providers use transvaginal ultrasound at your first appointment to confirm pregnancy and measure the fetal heart rate and size. This ultrasound also shows if you're expecting multiples. What should I not do in the first trimester of pregnancy? Once you find out you're pregnant, it's normal to have to make some lifestyle changes. These changes help ensure that everyone is healthy. You should avoid the following things during your first trimester of pregnancy: alcohol, cigarettes and tobacco, recreational drugs like opioids, contact sports like football or activities that put pressure on your abdomen, foods like raw fish, sushi, fish high in mercury, uncooked or undercooked meats, lunch meat and unpasteurized milk, cheese or juice, hot tubs and saunas. How do I take care of myself in the first trimester of pregnancy? Staying healthy is important throughout all 3 trimesters of pregnancy. Stay active as much as you can. Listen to your body and stop for rest if you feel any discomfort while exercising. You may need to modify your exercise routine during pregnancy. Take a prenatal vitamin containing folic acid. Eat a variety of healthy foods including fruits, vegetables, meat, eggs and whole grains. Get plenty of rest. Drink plenty of water. Attend all of your prenatal appointments. Is it normal to bleed during the first trimester of pregnancy? Light bleeding or spotting during pregnancy is usually okay in the first few weeks of pregnancy. Some people experience implantation bleeding. Call your healthcare provider if you're bleeding heavily or the bleeding lasts more than 1 day. What prenatal vitamin should I take? The vitamins and minerals in your food, or in prenatal vitamins, help support the fetus as it grows and develops. Most providers recommend taking a prenatal vitamin as soon as you begin trying to get pregnant. Vitamins containing folic acid, iron and calcium help support a healthy pregnancy. Talk to your provider if you're unsure about which prenatal vitamin to take. Can I drink caffeine during pregnancy? Most healthcare providers recommend limiting caffeine consumption. This is because a fetus can't metabolize caffeine, so it can build up in their body and cause complications. When should I call my pregnancy care provider during the first trimester? Call your provider right away if you have a fever higher than 100.4 degrees Fahrenheit, heavy bleeding or unusual vaginal discharge, severe cramping in your belly, arms or legs or abdominal pain, persistent vomiting and or diarrhea, fainting spells or dizziness, swelling in your hands, fingers or face, blurred vision or spots before your eyes. Pregnancy is an exciting, and sometimes scary, time in your life. You may feel overwhelmed with information and have lots of questions. During the first trimester of pregnancy, your body is growing and changing rapidly. The fetus is growing and developing, too. In fact, by the end of the first trimester, the fetus is the size of a lemon. You may begin having symptoms of pregnancy like nausea, sore breasts, or needing to pee more often. Schedule an appointment with a pregnancy care provider as soon as you know you're pregnant. Regular prenatal care is important so you and the fetus stay healthy and strong during pregnancy. Remember, knowledge is power, especially when it comes to the health and well-being of you. Kindly find the detailed video on healthy diet in pregnancy according semester and best workout in pregnancy in the playlist and description below. Stay informed, and there you have it, our amazing journey through the first trimester of pregnancy. You've seen how even the tiniest changes can lead to something truly magnificent. But remember, this is just the beginning of your pregnancy adventure. As you keep going, stay curious and keep learning about this incredible experience. Stay connected with your healthcare provider, take care of yourself, and enjoy every moment of this transformation. If you found this video helpful and want more insightful content like this, don't forget to hit that subscribe button below. Join our community for more exciting updates on your pregnancy journey. Until next time, take care and stay curious. See you in next awesome video.